Coronavirus disease, otherwise known as COVID-19, is an infectious disease caused by a newly discovered virus. Most people who fall sick with coronavirus disease will experience mild to moderate signs and symptoms. The World Health Organization declared the outbreak a public health emergency of international concern on the 30th of January 2020 and a pandemic on the 11th of March 2020.
We don't know what sort of damage this virus could do if it were to spread in a country with a weaker health system. We must act now to help countries prepare for that possibility. For all of these reasons, I'm declaring a public health emergency of international concern over the global outbreak of novel coronavirus.
Sierra Leone recorded its first case of the coronavirus on the 30th of March 2020, and on the 31st March 2020, President Julius Maada Bio made this declaration.
In my first address to the nation, I had indicated that it was not a matter of whether, but when. Ladies and gentlemen, the when is here. I have called this press conference today to announce that Sierra Leone has registered its index case. Case number 1 is imported. I repeat, case number 1 is imported.
From the outset, Sierra Leone's response has been led by science. First, His Excellency the President Julius Maada Bio established a scientific and technical advisory group to advise government on the scientific evolution of the pandemic and the pharmaceutical and non-pharmaceutical interventions needed to address the pandemic. Following the declaration of public emergency in March 2020, the National COVID-19 Emergency Response Center, NACOVAC, was set up as an interagency architecture to lead the fight against COVID-19. This multi-pillar structure, together with experts' representation and support from local and international partners like WHO, CDC, has been able to mobilize national and international solidarity, which helped in overcoming the first and second waves of the COVID-19 pandemic. Those two waves were less transmissible compared to the third wave that is now ravaging some parts of the world. This third wave is more transmissible, with peaks higher than the first and second waves. Sierra Leone is battling with a third wave that has ushered increased positivity rates, hospitalization and deaths. NACOVAC chair talks on the third wave.
Has been started by WHO that Sierra Leone has been through 2 waves, and this is the third wave that we face with COVID-19 outbreak in Sierra Leone. It's been established that it is serious, and we have established that we have a variant that is very virulent in the country.
Colonel Dr. Siva Lee is the case management lead at NACOVAC. He was part of the Ebola response in 2014-2015, and now lending that experience hand to the COVID-19 response. It takes us on a conducted tour of the 34 military treatment center, which hosts serious and critical cases.
The third wave means case management has to deal with higher number of cases, as we are already seeing. Case management has to expand capacity, have more bed spaces available. Case management must be able to develop critical care capacity. It means that we need increased amount of oxygen supply, increased amount of PPE, increased amount of medicines, and ultimately and unfortunately, we might record higher number of mortality.
So this is a 30-bed facility, and until recently it was full to capacity. But we are doing a step down now. That is patients that are asymptomatic, but they still have COVID-19. They are being transferred into another unit that is not a high dependency unit, where they are further managed so we can make space for more critically ill patients.
Part of the strategy to suppress the third wave in Sierra Leone is testing.
Testing for COVID-19 is done in 6 laboratories in country, 4 in the western area and 2 in the provinces. Based on the genomic sequencing done recently in Sierra Leone, we have discovered the Indian variant in 2 female samples.
Ramping up testing will enable Sierra Leone have a sense of the scope of infection, more so when a cross-sectional serologic study conducted in March this year suggests that there might be a seroprevalence of 2.8%. It is therefore timely that on July 1st, WHO, through funding from GIZ and German Corporation, has made a further donation of 10,000 antigen-based rapid diagnostic tests and 82,000 sample collection kits.
It is our great pleasure and honor as WHO, GIZ, and the German government working together. We are honored to hand over laboratory testing materials to support the COVID-19 testing and adherence to containment measures in the country.
Surveillance is being intensified to trace contacts and break the chain of transmission.
In the case of the third wave, we intensify the surveillance activities to ensure more people are tested. Particularly, people are tested from locations that we think will yield high yield, like health facilities. The third wave in Sierra Leone is somehow peculiar as compared to the first and the second wave. The third wave came up with a lot of symptomatic cases, and even the demographics change. We see more young people with symptomatic with signs and symptoms of COVID as compared to the first and the second wave.
The risk and event information is being communicated, and the public is being updated on general health advisory. I am advising everyone to stay safe and stick to the science. I am also advising everyone that is eligible for the vaccines, I mean from 30 years and above, or health workers 18 years and above, to take the vaccines. The vaccines are safe and effective. I have taken my second dose, for over 2 months now. So I am advising everyone to continue to stay safe and stick to the science.
There are so many benefits of receiving the COVID-19 vaccination. First of all, the chances of getting infected reduces significantly when we are vaccinated. And even if we get infected, the chances of having an adverse outcome, which can be death or severe illness, is also very, very minimal.
1 month into confronting the third wave, the Delta variant is detected in 2 samples in Sierra Leone.
Sierra Leone is effectively in the third wave. And we know, as WHO has advised, the peak of the third wave is significantly higher than the first and second waves. Not only that, we have also detected the Delta variant, the dominant global variant. Very ruthless. That one day in the play.
What an unsettling moment, especially when you see how this strain has caused monumental rise in cases, hospitalization and death. In India, where the strain was first detected, and in other regions, countries and territories around the world, including Sierra Leone. 16 months into the response, Sierra Leone, highly commended for the fight against COVID-19, is now faced with an extremely difficult wave and a very lethal variant of concern, from labs to surveillance, from case management to quarantine. NACOVAC operational capabilities are being tested and stretched again.
NACOVAC has been able to use some enforcement measures to curb this third wave. Some of these include the deployment of our security personnel at public buildings and vaccination centers. We deploy them at the public buildings to inspect or to verify that people are vaccinated before they enter these facilities.
To address the third wave will require robust surveillance. The surge activities, which are focused on the western area as the epicenter of the disease, will ensure exactly that. NACOVAC and the Ministry of Health and Sanitation continue to urge the country's adult population to get vaccinated.
We need to ensure that to prevent our people, we encourage everyone to take the vaccines.
Now we have vaccines. We have vaccines in our arsenal. These vaccines are free. These vaccines are safe. These vaccines are efficacious. Now we have to mount an opportunity here to make these vaccines available to everybody.
The ambition is to have 70% of the adult population inoculated. The race to accomplish that is monumental, but there are positive signs. The vaccine uptake is encouraging, and more static and mobile centers are being set up. The Sinopharm and AstraZeneca vaccines have been approved by WHO and are said to have met safety and efficacy standards, according to the country's pharmacy board.
And so far, we can confidently say that what we've evaluated so far, the vaccine is good to go, the vaccine is safe.
With the nation's commander-in-chief as the first to receive the COVID-19 jab, the citizens feel greatly encouraged by that fine example.
I've taken a COVID vaccine. I took the first one in May and my second dose in June. And I want to encourage my fellow Sierra Leoneans. The vaccine is safe. I had no complications. I just want to encourage my fellow Sierra Leoneans. Go for your vaccines.
NACOVAC's message on the preventive guidelines and vaccination remains to be consistent and as simple as ABC and 1, 2, 3.
For the one that we go nursery school, class 1, remember say, then teach we 1, 2, 3, and ABC. Remember also, the one that they nine are the basics. Well, for fight this corona fight, the basics. Now for wear your face mask and wear them properly, wash your hand with soap and clean water, not in up or sit down near a person. And now, because of the kind of way people in the die, and this third wave na coronavirus and this Delta variant where they don't detect that salon, do ya take your vaccine now. And for that we all people already, because the science don't tell we say over 70% of the one that we don't get this infection now young people where they below 45 years. And then same young people, and then they take this virus, they go transfer to them old people and the one that we sick. So they are looking at your family, looking at the place where you work, looking at your community. Encourage them when they were old and we get them stronger sick them where the public health people that they call underlying medical condition. Encourage them for take the vaccine now.
Corona fed, now we all fed.